Turns the light.
Resource navigator to see if we're getting anywhere with emergency foster care for baby Jane Doe.
Yay! Since the live stream ended. Nice. We only have 1 hour left, guys. Only 1 hour left.
You feel pretty good about getting out of here.
Sure, Mr. Bracken was 16. He could totally.
She went offline.
I'm hoping to catch another.
No.
One more gets me to 3 in my first week. Probably a record.
I'm looking for an easy one. Shift ends in 2 hours. We're supposed to pick up the stable patient.
Well, she gone.
Do you need a second opinion on that?
No.
Dr. McKay. A girl named Kiki came into reception looking
We only have 1 hour, guys. 1 hour left. We only have 1 hour left.
Thanks.
Just like this.
Hey, I think the labs are back on the other patient.
Thanks.
Everything okay?
Langdon.
Midnight's
We got a sec. There's something.
Santos, need you to pick up food poisoning in 12. Or why not? What? No snark? No pushback? What have you done with Santos?
2 hours to go.
Hello, Ed there. Hello there.
That's the spirit.
How's Becca?
She's good.
I'm trying to call her good in community, but they're not picking up.
Why call?
Because I don't know anything about this Adam person. I mean, they've been dating for 6 months, and I don't know anything. She never said anything about wanting a boyfriend or even liking anyone.
It doesn't mean she hasn't thought about it.
And I don't want to think about my sister thinking about having sex. I mean, it's just like he didn't take advantage of her. Middle Hill just let it happen. Why didn't they tell me?
Maybe they didn't know about it.
6 months, they had to have known. Maybe it was a mistake choosing Middle Hill. I mean, we saw a lot of good places, but that is where Becca wanted to go.
Are you Becca's legal guardian?
No, I have durable power of attorney, but we did this thing called supported decision making where she can make her own decisions.
There you go.
This is different.
Why?
Because
Hey, official reel.
I'm sorry, this is not making.
I got a hard and unresponsive child.
Hey there, official underscore reel.
Need a Cortab Beta. Hi, I'm Dr. Al-Hashimi. Are you
Hey there.
Guys are Mindy, and this is Micah.
Has Micah been sick with a fever?
No, he was fine all day. I found him in his car.
Pupils are sluggish, but
Hey there.
no reaction to pain.
Airway is paying with low tidal volume.
I don't use it real quick. I don't really use it, but sometimes I use it on videos. I think videos. Yeah, I use it on videos just for entertainment.
Assisting with ventilation. Somebody call respiratory.
He said he just found him. I was working in the garden when he rode his bike on the drive, but 1 minute he was there.
It's magnetic.
I thought he had gone into the house, but I couldn't find him anywhere. He must have gotten tired and climbed in and fallen asleep. By the time I found him, I couldn't wake him up.
How long was he in there?
Maybe 15 minutes or 20.
And the car was just unlocked.
It's a safe neighborhood.
Jordan. So, you're going to want to start at the head, measure the length, and then read it off.
Approximate weight is 25 kilograms.
250 bullets of LR.
I have doses for rock and ketamine.
Almost no time. I can do this without meds. It's easy enough to bag. Let's wait for R2.
When the temperature is this high, the muscles can lose their strength. So we're going to help him breathe quickly.
Rectal temp is 105.5.
Heat stroke.
Ice packs to the groin and axilla.
See if we have an Arctic sun that's not in use. We need all the ice we can get. And a pediatric body bag. Still waiting on your ketorolac pills. I will keep following up with the pharmacy.
I told my son I would meet him at the park. We always watch the fireworks together. Sorry, Mr. Green, I won't forget about you. But you had a heart attack.
I did not have a heart attack. Hey, Sarah, how are you feeling? I'm totally fine.
Glad to hear it.
Hey,
Hey everybody.
Just for 5 minutes, I have to step out for a sec. No problem. Ogilvy, you,
We're just waiting for the update. It's literally 10:04 right now.
Intubation be required?
no. It's an unhoused patient I've treated on the street team.
Hey.
I'm sorry. It's just surprised. The nurse said I can leave. Yeah, let me just finish our conversation first. About what?
I know you don't have to tell me anything. I just. I know. Adam asked you to have sex.
He didn't ask me. I asked him.
He didn't pressure you?
No.
You wanted to have sex.
I wanted to have sex. Sex was great. We talked about sex in my mind and body class. I told my therapist too.
Yeah, pancreatitis in North 3 still waiting for you.
Can I go now?
Just 1 second. I'll be right there. I'm just gonna walk my sister out. Yeah, sorry, I'm right behind you.
Curtis Larson, 42, called to the golf course for combative behavior with his buddies. No signs of trauma, just alcohol on the breath.
Seems to have calmed down a bit.
And he's fighting us so hard we have to give 4 milligrams of Versed to get vitals in a line. Good BP, pulse ox 99 on 2 liters.
Between losing the Versed, he'll be sleeping it off for a while.
Central 14, guys.
Moxie's gone.
His husband's still there?
Yeah, Chipotle's with him. She needs a death note. I can't find McKay.
Yeah, I'm right there. Have you seen McKay?
No.
You ever seen a xylazine wound?
No.
But you know what it is.
Yes.
And you know its street name is Trank, and this shit is nasty and we can skin the purchase.
I've never understood your reputation.
Well, you need to try. A little empathy goes a long way in this job.
I am empathetic. I don't understand how an intelligent person allows themselves.
Can make mistakes, heal themselves, take away the pain, fight from the abuse. A healer is not judging it.
Shouldn't we go to the crosswalk? No? Okay. I see you're in my future. Sorry.
Mr. Geller, Kiki. Who's this? Oh, it's Ogilvy. He's a student doctor that can help me. What's happening with you? My legs getting stinky again? Yeah. Okay, let's take a look.
Is that an injection site?
No, xylazine wounds can show up anywhere. You still need a drink?
Sometimes it's not good, Kiki. It's nasty stuff.
I'm trying to quit. And how you went about that? go to meetings sometimes.
Meetings are good. Not used since it was ever. Okay, what's your plan, Uncle V? Uncle V, you okay?
Yes.
Yeah?
Absolutely. My plan is clean with saline, antibiotics,
Honey to break down the escort. And then?
readjust with zero form and an ABD pattern curls, right?
Yeah, that'll do it. You need to change this dressing every day, Kenji, okay?
I don't think I can do that.
We'll give you all the supplies you can do it yourself. You won't even have to come back here.
Yeah.
Okay, I'm feeling.
Hey, I'm Dr. Whitaker. This is Dr. Santos.
Roberto, like Roberto Clemente.
Oh, sorry, I don't know who that is.
Pirates Hall of Famer Roberto Clemente. You watch baseball?
Well, I'm from Nebraska. We went to a few Storm Chasers games as a kid. That's about it. No major league team, you know.
Alright, what happened to your elbow?
Oleo, please. It's a walk-off tater, right? And I catch it, you know, up. And I think I heard a pop. Hard to tell if I was screaming.
Sound pretty dangerous.
You're not one of those guys who steals balls from kids, are you?
I didn't steal this. I wouldn't do that. I would never do that.
Can you move your fingers for me?
And the thumb?
No. You know what? We can put that in a ball.
No, thanks. I think I will hold on to this.
Okay, you know what? We can put you in a sling, and then you can hold on to the ball while we examine it.
Okay, yeah, I guess.
I'm gonna throw in an IV and start with 4 morphine.
No. I won't be knocked out.
No, it's a low dose. You won't be knocked out. It'll just help with the pain. Might make you look dressable.
I need to stay alert.
Okay. We will order you an X-ray. Just please let us know if you change your mind.
Okay, yeah. Take this down to 103.5.
I'm weighing 98.6.
102, we take them off the ice. Otherwise, we overshoot and cause hypothermia. Put in orders for CPA.
What does the CPA tell us, Julie? Reactive for muscle breakdown can take out the kidneys.
More concerned about his brain.
It's 2 times a day for 3 days, and a nurse can refresh it.
Dr. Lincoln already told me.
Okay, bye now. I'll see you at fireworks.
Oh, I was going to watch fireworks with Adam and his parents.
Where?
At the park. They're picking us up. They go every year.
We always watch the fireworks together. I have your phone.
Adam said he has extra.
Okay, well, do you have Adam's parents' phone number?
Why?
In case I need to reach them?
I want to go now.
Well, I guess I could
Bye
call
now.
this-
So how long have you been part of the street team?
Oh, about a year?
And why do you do it?
Oh, most of these unhoused folks feel abandoned. Sorry. They don't trust easily. Meeting them where they're at makes a big difference. I've been trying to get Kiki to come by for months. You should volunteer. It's great training and teaching for always as well.
Yeah. Maybe. Thank you. Hey, how'd the deposition go?
I'm glad it's over. I didn't feel good about it at all. You know, I'm still not supposed to talk about it.
No, but you can talk about how you feel. Who do you have to talk to when things aren't going so good? Friends? Family?
See, I don't really have...
Hey, McKay, where have you been?
Oh, I stepped out.
Did you tell anybody?
I was treating a young woman I met on the street team.
Did you check in as a patient?
No, we treated her in the park.
We?
I took over.
Oh, okay, so you treated her outside the ED on PTMC's dime, and you brought a medical student with you right when we're in the middle of crisis and we need all hands on deck.
For 10 minutes
So
tops.
here, I need you to be here, and while you stepped out, Roxy died.
think she would be gone that quickly.
Excuse me. She took a nasty fall, her shoulder, screamed in pain with the ties on. Hello, I'm Dr. Rabinovich. This is Dr. McKay. Agents Correa and Rousseau. She needs to be looked at before we process her.
What's your name? Anita. I'm gonna take care of you, okay?
You said she fell? Dr. No. Sweep better arrest her. When the picture took off, she was shoved down some alley stairs.
Yeah, rotator cuff tear and AC separation.
Put her in a chair, find her a room.
South 18.
Curtis. Dude. What happened?
Medics had to sedate him to transport.
Didn't realize he was such a heavy drunk.
So you've seen him drunk before.
Sure. Yeah, but never like this. He tried to pick a fight with the guys in front of us. He said they were going too slow. That's what they call the cops.
But he don't take any drugs.
If he did, they were not performance enhancing errand. So 112.
We'll order labs. See what we can figure out.
Any family we can contact?
No idea. We don't talk about that shit. How long is he gonna be here?
At least 3 or 4 hours till he sobers up.
Cool. It's okay if we just come back around 9? Sure. Great, thanks.
Agents remove so I can check her vital signs.
Send you over the AC. Lift your right arm up above your shoulder like this.
Heart rate's 110, pulse ox 98.
And pull our chest is positive.
Do I drop on test?
Lift your arm up. Just lower it as slowly as you can, okay? Positive drop arm test.
What's that mean? That means that she's going to require an x-ray. It's most likely a rotator cuff tear, which sometimes can come with a fracture when the x-ray goes out. How long is that going to take? Well, our computers are down today. Everything's moving a little slower than usual, but we will fast track her.
Is there anyone who wants to call Anita?
No phone calls. Got her bathroom. I do not want these guys here any longer than they need to be, so let's find an x-ray and fast track this one.
If you're really worried, maybe I can call them.
Just stay with her, make sure she has everything she needs to treat her injury, and that's it.
I make it out to window 3, please. I make it out to window 3.
Está pasando atrás. Aquí. Está buscando a alguien. No sé.
Tried a ladder room. Best I could.
Posterior dislocation, no fracture. Thanks. Good news, Roberto. No broken bones. But the elbow joint is dislocated. We need to get the ball back in the socket. Best way is with sedation and pain meds.
No, I know you said the morphine, but we can put local anesthetic into the joint to block the pain. That way you won't be sedated.
No,
That's it.
thanks, Doc. Just give me both vital.
St. Joseph and Green Tree. Oh man, I love that place. What I wanted to employees.
It says here, people are leaving the waiting room. 10 patients already. What should I do?
Tell them the truth. I hope they're safe and the training that they need.
Martin took off. I'm gonna call her when I get a chance.
Shit, yeah, make sure she's okay. Will you call the EVS department and let them know?
Will do.
Hold down the fort. Let us know if you need backup.
You got it.
Can't we just tell the agents to fuck off?
They are not going to leave without their patients. We just need to treat her.
As soon as she's undocumented, all patients, regardless of immigration status, have the right to emergency care under MTALA. Anita's next in line for X-ray.
Thank you.
Propofol down to 105 per minute. Tempest 148. Great. Let's get him up.
Okay, hands. On my count. 1, 2, 3. latest? We got some arm movement.
That's a good sign.
And pupils are memory active.
Cases are down going.
All encouraging signs. Any luck getting a lawyer for our detainee? Did you post it?
Pretty bracelet.
My daughter made it for me. She doesn't know it now. I just wanted to know that I'm okay. Seriously, won't let her make a phone call?
Oh, that's how she's processed.
Unbelievable.
Thanks, and just let me know when she gets back. One other thing, do you have a resident named Adam? I was wondering if I could get his parents' phone number.
Nope. Red phone is for emergencies only.
This is kind of an emergency. Sorry, bye.
Hey, Mel, we need an R3 supervisor reduction in North 4. You free?
I guess.
Should we move the deceased woman in Central 9 to viewing?
No, we'll sleep my husband in there for a little while longer.
Leave her alone. We're not moving it yet. Okay, sorry. Dear Bernadette.
It's ICU says they'll have the bed soon.
Okay.
So what do we think?
That one.
The mom of our heat stroke kid?
That is not our job. This is what CYS is for.
So you think it was on purpose?
No, I did not say that.
I still buy it. She lost her kid at home, but she just looks guilty. Has anyone seen her cry?
People don't always respond to trauma the way you expect it. They focus on the kid.
He's 42, stats 87.
You having some pain again, Mr. Green? Mr. Green?
This one's yours?
Yeah, kidney stone, possible vasovagal?
I need some help here. Does he have an IV?
No, he didn't need one.
Hypotensive and hypoxic. Mayor Traumer?
Yes.
He was just waiting on his discharge, and that's pain-free.
Patients are gone from Sheriff's Office due to cause death.
History of renal colic, heme positive, urine BP crashing.
Kidney positive urine doesn't always mean kidney stone. 2 intrahumeral lines, biggest ones we've got. Eat fast. Don't get 2 units of whole blood home, please. Who worked up this patient? I did. Ultrasound showed dilated urinary and mild left hydronephrosis consistent with his history of renal colic. What about the aorta? I didn't look at the aorta. Who did you present to? Dr. Mohan?
So the rest of the ultrasound was normal.
I meant that the other kidney was wrong.
8cm AAA with massive fluid. Fraction can make any reason. Need it out.
Can I go with the MCP?
16 gauge in the left ACP and full blood on the infuser.
Assisting ventilations. Respirator.
Okay, who wants to debate? Right?
Sure.
Can't call for 6 more units, so whole blood instead of cold surgery. We stay ahead of them. And we'll get them up to the door. Here we go.
We're lightening up his sedation to see if he has any purpose home. So, that will be an exciting time. Be back tomorrow. There's no certainty as to how much recovery Michael will have. His response over the next 24 hours will tell. There is a chance of cognitive impairment. Also a chance of meaningful recovery.
Engagement 22.
Hello.
I will be right back.
I'm in. Bathroom.
Nicely done, good job.
I've got a 16 day DJ.
That one goes over rather than easier.
Good and tight away for him.
So, radio pulse, that's a very good sign.
BP's up 86 over 52.
Progress.
About 2 grams TXA?
What else do we give after 40 ounces of blood?
Calcium glutamate to counteract hypocalcemia caused by the strand anticoagulant.
You see if you can't squeeze a unit into that peripheral line. Should somebody place a central line?
Long central line is slower than short, large, or peripheral.
Flow is proportional to the force power of the physics.
Okay. Right down on this.
Okay. I'm stabilizing the humerus.
Right after I supinate the traction, Dr. Riddick will apply downward pressure on the proximal forearm.
Okay. This is gonna hurt like hell, Roberto. 1, 2, 3.
Okay, that's it. Oh, flexing at the elbow.
Belly's down to 68. Legs 5 and 6 are up and running.
Here towards Garcia, vascular can't come down.
Both
Both of you died in a few minutes.
is stable, presented with a history of renal column.
And nobody saw the AAA on ultrasound? Is this you?
No. There's me.
Looks like sinus attack.
Oh, lost the pulse. It's PEA.
Bag him. Oh, let me start compressions.
I'm having a hard time staying out of the blood loss here.
Get on gloves. Prep for a thoracotomy.
Giovanni, why don't you glove up and show that the things you might belong in the ED? To compress tank the aorta, and stuff the blood flow from below the diaphragm to confuse the heart and the brain.
10 minutes.
Woo!
Yeah, scissors. That's better? Sajinsky.
Let me know when you have it.
Right there.
If you need me on section, come down in the chest, it's all done. Yeah, keep squeezing.
Aorta's clamped. Heart is empty.
Okay, Giovanni, get in there. Internal compressions. Go. 2 more units on the rapid diffuser, please.
Double unit 7 and 8.
Unauthorized use of the bike lane ka rin. Obstruction sa sidewalk. Oh, obstructing sa sidewalk. Bawal ka dyan, Javi.
Neuro's intact. So we're doing post-choice funds, Olson, and
Obstructing
Porter.
sa sidewalk.
You know, I'm actually kind of impressed you did that without getting extra.
Definitely worth it. You know, last year I caught McCutcheon 300 career homer, but another fan stole it. House and stuff. I never let that happen.
Yeah, you already put in the T sheets.
No, I didn't.
Yeah, I kind of had plans. Should probably finish it.
Well, okay, someone do this. I don't care who.
She stepped out.
Stepped out? Feels like the heart's going back up.
That's how it beat.
Strong renal force.
That's lock pads, pressure transfer. Systolic 94.
Boy, have a face out. Oh no. Opening up to make me a headline.
What travels fast? Remember the DJing with a rotator cuff.
This is my phone. They have temporary protective status. I just don't feel safe.
I'm really sorry, Dr. Robbins. I should have checked that. What was you want to miss? The heartbeat back also. Still small?
I'm sorry, too. I should have asked Uncle Pete. Okay, or not. It's my fault.
It is. You're the senior resident. You don't look at this other than you.
I know, I'm really sorry.
This is what happens when you bring your personal life into work. Patient almost died.
I know.
You have to think of this. It's like a force field. You cannot make anything in. Your mother's not in here. She is out there. You keep everything out there. That is the key. That is the difference between the best doctors and the ones that don't make it.
You're right. Maybe I just don't belong here. Can we just extra results?
Hey, this is fitter for a swing, I guess, and we have to discharge her.
To the inhibition house?
Train stalled. Okay, time for you to go. Southwest Shaw's Peterson. You can see how big this department is, right? You've been nothing but a distraction and a disruption since you've been here. I'm already short-staffed, and I just lost 5 nurses and half my environmental services team because you walked in. You know, patients come in here for help, right? Because they're either sick or they're injured, and documented or undocumented, they have a right to emergency care. TB, measles, fractures, none of it's getting treated because everybody's too scared to come in. But then they end up here anyway, but then it's too fucking late. So please, for the love of God, can you just go wait over there in the room with your detainees so I don't lose any orders? No problem, Doc.
This is Dr. Mendy.
Bro, the music stopped.
Brenda, where are you going? It's okay. Let's get her back inside your son. It's okay. It's okay.
Prepared to go.
Hold on, she needs to stay.
It's only take a minute. We're leaving.
Hey, man, you're hurting.
Jesus Christ, what's going on now? Get your head on. I know.
Hera.
Don't say anything. You don't have to say anything. They can't make you say anything. We'll get you an attorney. I promise we'll get you out. Call the hospital attorney again.
I can't believe this shit.
You at least tell us where you're taking them. Is there a detention center near Pittsburgh? That's got to be where they're going, right?
3 hours before he's processed. I'll stay on it. What can we do?
Hey, Giovanni, please come back. Everybody, just go check on your patients, assure them, tell them what happened, but please, everybody get back to work.
Justice space. I can do it. Thanks, Carla. Okay?
Yeah, okay, you okay?
Yeah.
The boys are tied up with the cyber attacks upstairs. They probably won't come down for a while.
Where's the laser? That looks okay.
I still have to pay back to him.
I think it was intentional. I told her to not to let her up. I said, we need to call her 302 and observe her.
Danger yourself. She's gonna be able to see her kid. She's on an involuntary cycle. And what happens if he's ready to discharge her shoes?
Does she have a partner or what typically that? You can find out.
Why don't you and I talk to her together?
I just need to check on the patient now.
Hey, Emma, have you seen this patient?
Oh, I haven't. Oh, she took off when those ICE guys arrested your nurse.
It's almost here.
CBC got alcohol back in the bowl for this last thing. 0.14.
Copy that. Okay, we'll wait for the other labs. We need to sleep it off in the meantime.
Hey, Gabriel, can you wait a sec? Do you have 2 people to stress it? Yeah. Are you on just number 3? Okay.
start making arrangements.
Darling, take some time for yourself. Do it.
Spend so much time with these people. You become part of my family. It's not like it is for vacation time. I just can't keep it on shit. It really goes back to my brother worked. I'm sick. Try it. Let's just listen to me. Take the night off. I'll cover for you and talk about things that do it.
Think she's gonna be okay?
I just hope she can be a good person. Sometimes you need to remind yourself this. That you love this.
I want something for my birthday. I'm planning for my birthday. I want something for my birthday. I'm planning. I'm planning from something for my birthday. I'm planning something for my birthday. For my birthday, I want Robux. So if we can afford, only lang. Kung hindi natin afford, bawa. Sige no. Or hindi Tialdos na lang.
She's a boyfriend. She didn't tell me about. She didn't tell me about. She's having sex. Great sex. And she likes it, and she's out in my face for 6 months. My sister is a fucking liar. She just tries to. It's crazy. I've seen Alpha 164 times. That's all. So we watch out. And she's got everything in it, and now she's got a boyfriend, and they're gonna fall in love, and they're gonna get married, and I'm gonna be completely alone. It feel good to say that out loud. No. You're a good egg.
So this is your heart. These are your lungs. They look okay? Yeah, it's this part right here, this space right between your lungs. It's called the mediastinum. It is enlarged. It is too wide. From what? Can't really tell from the plain film. It could mean a number of things. Yeah. It could be an enlarged thyroid. It could be lymph nodes from infection. It could possibly be a tumor. You think I have lung cancer? I don't see that. Cancer in the lymph nodes is probably involved. And there are a lot of diseases. The aorta, which is this big artery that comes off, which can get enlarged because of a weak spot in the wall, kind of like a bubble in a tire. From blood. And the only way to make sure is to do a CT scan of your chest today. How long does that take? 2 hours, couple hours. You still gonna be here? I wouldn't feel good about riding if I rushed this. This is important. The labs are back on this new page. That's where we're at.
Thanks.
Look, I don't know how to say this. I know you don't like it. That's fine. I just want to say I'm sorry.
being an asshole. It's completely inappropriate. If I could take back what happened, I would, but I can't.
Okay. Okay, I'm sorry. I don't buy it. Everyone thinks you're just an addict who went to rehab. And you've convinced everyone here that you've changed and you're owning up to your mistakes and they welcome you back with open arms because you're still the golden boy, and I think it's bullshit.
I'm genuinely sorry. And I can promise you, I based my fair share of punishment for what I did.
You fucking stole drugs from the hospital. Only 3 people here actually know that. Have you told anyone else what you did? Have you?
I'm just trying to get through my first day back.
You shouldn't even be here. I should have reported you to the state medical board. You should have lost your license and gone to prison.
You don't know what I've been through.
You've been through?
My wife threatened to divorce me, okay? I almost lost my kid.
Yeah, that's what happens when you fuck up.
You don't have to accept my apology. I wanted to say it. Okay?
You really want to atone for your sins? Tell everyone here you stole drugs and don't take responsibility because of it. Until then, stay out of my way.
Oh. My screen!
Fuck!
I'm just checking your vital signs. Oh.
Where am I? Alex, what did you do to me? Ah!
Pinocchio.
Donnie, thank you. I'm sorry. We'll get another nurse to your place, Jesse. Do we even know when his last nurse was taken? No, but the hospital are all over. They're gonna get you on. What's going on? It's the cold pool, Central 14. Whoa, 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 whoa! What the hell happened?
You jacked up more. Give a shot, son. Down.
You're right. How do you get bloody nose?
He's sick.
Listen.
Yeah,
Where's Oakley?
upstairs. They got in on that kidney stone from before.
One day next week's my actual is from the ED. Oh, present company excluded. Yeah, great.
Hey, can I get you
Midnight Sun.
Kind of lied to you on night, student.
Really?
Call you fancy at the pitch. Kind of you secretly living in the hospital for months.
It wasn't months.
Still waiting on labs, x-rays, meds. PTMC, go ahead, medic command. Where are the nurses? There's a pump room in Central Forks Nation.
Oh no.
What's that?
Hospital worker assault.
Ooh. The new nurse panel.
Okay.
Think so. Smells like you got him. This place is going tits up.
We all get in here. Oh, yeah. You sure you're all right? So, what exactly happened?
They throw it because we're going to give him a shot.
Right, did he slip before or after the shot?
Yeah, I mean, I didn't see what happened.
What did you give him?
4 milligrams of Versed.
Who wrote the order?
Had in my pocket. Was on my way west to the suicide place. What?
Okay.
Okay, so now he's altered from alcohol versus and trauma. Now we need an NCT to rule it intracranial bleeding infraction.
Would you rather be Emma with a head injury or worse? Don't worry about it. We got this.
No, there's no way here. You need to pass this patient off and report him.
Fine. I mean, you don't look as bad. I'll handle it.
This is my emergency department, and I'm telling you to exit off.
If my nurses and just basically were interested for 1 minute, doesn't anyone ask for my stuff or with that asshole? You gotta give your fucking head straight. Come on.
Envy, go ahead.
Okay, I'll be right there. Thank you.
No. He's not dead. He's recovering in pediatric ICU.
We'll be back to check on you again shortly, Miss Hatcherman.
Has her husband arrived yet?
Yeah, but he went straight upstairs.
Really?
He may have just wanted to see his child first. Let's not jump to conclusions. Dr. Robbie, can I have a word?
Shoot.
In private.
Let's start to talk.
Thank you.
What is this about?
I'm going to recommend this ED have 2 attendings on shift at all times moving forward. This department is clearly too much for one person to handle. It's not healthy for the patients, and I'm very concerned by what I witnessed today with some of the staff. What is going on with Lily and Santos? I started having Dr. Dr. Huntington hasn't even been here for 10 months, and you told me this morning there was nothing to worry about with Lily Santos.
There isn't. Santos and Langdon have beef because she's the one who turned in for taking meds.
I'm sorry, what?
Santos is responsible for revealing Langdon's Benzo addiction.
Is he stealing drugs from this ED?
This ED is the best of the best, and I would put it up against any emergency department in the country, and it is going to be yours to fuck up, so don't fuck it up.
Cushions from Jimilan, which one is better? As here, Jimilan's black truffles ABC antioxidant hair cushion. We have here the Jimilan
questions
black
about
truffle bleach AI coverage cushion. Already the video about already so how good this product is. So today, let's do a side-by-side comparison. Both variant and with shade natural version.
Some kind of alien savant. We no longer use that term.
Guess it's time to leave. Once they
Actually, I'm Gen Z. Even worse. I was stripping a purgatory to put myself through school when I was your age. No flinch.
Yeah, I'm getting off. You're a thought. I'll give you a call when I get a better idea.
12 minutes.
Joel Frost, this week on Friday. What's his name? Oliver. Yeah, Oliver. Can you open your eyes for me? Here we go.
Trying to get a severe respiratory distress.
Left side of the house is shut, probably renal failure and fluid overload. Respiratory center flat back.
This is last dialysis?
It was supposed to be yesterday morning. Could be tonight, surgery ASAP. Is that the guy who attacked Emma? Is he going to CT?
Yeah, Miss Emihan needs an HCP.
Cassie, can you give Emma here a workup?
Started chart with Camilla Soul. Really? I'm not he's joking. Irritation now. Brain damage suffering. Communication needs mixed. Is that really necessary? Absolutely. Wow.
Well, you guys just call my guy to CT.
Not my guy.
She was forever. I'm not really excited.
Tell it to somebody.
You know what? You should care. That guy has serious injury is forced inflicted from something you are not licensed to.
Everyone else is supposed to stop and stop doing good. And they're supposed to do it.
Just had that virus in the party.
It's extra pneumatics for timing, I guess.
Only ways to control substance for me to witness to something.
I was on my way to when I spotted that I started attacking a girl. Anything else, Mr. Joe?
Where are you going?
Kicking a pig. Do I need your permission to do that too now?
Almost there. 10:49. There's 11 minutes now, right? 11 minutes.
Best to avoid that if possible. Pressure support after low reduction by this time of dialysis. Bypass training to number 5.
Heart squeeze, good lung sliding, but there's a ton of delays.
Pulmonary edema.
Which is best treated by what, Dr. Giovanni?
Nitrates.
Dose?
BP 198 over 132, pulse 120, pulse was only 85.
Could be a P. Let's start 400 mics per minute for 2 to 5 minutes.
I was asking Dr. Jones. Don't you want to start low with nitrate and titrate up? In flash pulmonary edema, we do the opposite.
He really needs his dialysis to get fluid off.
What's his dialysis schedule?
Monday, Wednesday, Friday. He missed yesterday because of the wedding. We tried to go to the center this morning. It's usually open on Saturday, but I think it's close to the 4th.
Where do you live?
Brookville.
It's like an hour and a half.
Yes, ma'am. I tried Pinehurst Hospital in Fort City, but I didn't know they shut down.
Yeah, you sure did.
All right, sister. Can I help uncluster this clusterfuck?
Ready to finish our conversation?
You talk. Not that I need to.
Please.
Patients today. I still put them in there. It's just these eyebrows also turn us back into 1999.
Well, I'm worried about you. You might not be yourself today.
It's good.
Give me your receipt. Go ahead. Take it.
Or you can marry. Sometimes I can just take them back to human consumer.
As soon as you got the motorcycle.
Just about the motorcycles, about the whole damn thing. Ron, you're actually telling me that you're going to a place called Smash Lake.
Close. Not quite. Just not
Robbie, you're ready to because it's a small meeting and doing it.
Okay, I'll be right there.
What's that? It's not 15.
Woman, very low speed auto response from ground level fall. Bruising on her left hip, near head trauma.
Who's medicated? I need to start touching you. Come with us. We're gonna get you set up right over here.
Sorry, we'll get you something for the pain shortly.
Do you have any medical problems, Rita? High blood pressure, low thyroid, AFib.
Any chest pain, shortness of breath?
No?
So, what happened?
Actually,
Walked into the car.
you hit me.
No, I didn't hit you. You hit the car.
Yeah, right to me.
I wasn't even moving. He wasn't very good hands now. Yes.
Before we get you in a gown, we'd like to check your hip. Of course.
I'm sorry. We had a whole bunch of craziness coming, and you got bumped down a patient or two for CT. But take comfort in knowing this was some pretty nasty stuff. How am I supposed to find comfort? No, or anything you told me since I got here. I don't know, but everything is supposed to come with a lesson. This is more of you saying motorcycle bullshit. Maybe. No, it's because of the stars. I appreciate the effort. You guys are obviously jammed up. I'll just come back when it's not an issue. You're already here. It's not going to be that much longer, I promise. Just stay and get your CT. I will do it all when you get back, and this place is less crazy. This is always crazy. I don't know when I'm going to get back. Can you just sit the fuck down, wait a little bit longer? It won't kill you. Leave you light. Okay. Problem. Thank you.
That's a nasty bruise.
Do you take aspirin or any blood thinners?
Eliquis from my AFib?
Any tenderness here?
No, not really.
Here?
Oh, yeah, that hurts. 4 of morphine and Zofran.
What about up here?
Yeah, really? Yeah, so let's start with labs and clinical.
No, CT.
5 minutes!
That'll be of the hip and check the bleeding. The Aliquis is concerning.
You think she broke her hip?
If it's broken, you broke it. Usually for a broken hip, the baby shortened and rotates out. But we'll just wait for CT results. Mr. Cohen, I know that you were checked out soon, but I was wondering if I could do a quick examination with you.
Oh, no, I'm fine. I was in the car. Just out of frustration. Okay.
Deep breath for me. Good. Again? Great. Thanks, Eddie. Next thing, would you mind taking your shoes off? Just busy.
My back's not what it used to be.
Let me help you. You and me both. Dr. King, did you think about doing a Romberg test?
What is it? It's a general evaluation of balance. Can you stand up, sir?
How are you doing, Oliver?
Tests are not coming out. The pressure's holding on 400 nitro and it's back up to 20 on 10.
We could try phlebotomy to decrease the throughput of the
Aray ko. It's April 4.
Hemoglobin's only 9.2.
No, we do the flesh and clothes if he's doing that. Like valuable blood level, essentially. And that is something you should step up for, basically. Casey?
Got a good vein for 16, 1 down her back, 500 cc's in the morning.
Ganito pala mag-makeup ang mga flight attendant. Naging flight attendant ako ng 8 years. Lagi akong ginagawa.
100%, no more exam, no enhanced surgery.
In some cases, smaller is better. Let me explain. Habang tumatagal, I really like to travel light. I can't neglect my face card, so I'm introducing a mini cushion. Your touch and go, anywhere, everywhere. It is everything you need in a matte cushion, but with all the convenience. It is infused with skincare and triple antioxidants.